On Health Check at 11, bloodless surgery. What started out as an alternative for some religious groups is now becoming more mainstream. The goal is to conserve and make better use of a precious resource, your blood. Health reporter and registered nurse Allie Gorman has the details.
Jock Davis of Rochester, New York may not look sick, but for years this 48-year-old businessman has been battling a deadly blood cancer called multiple myeloma. Chemotherapy helped, but became less effective. He needed a stem cell transplant, but there was a hitch.
They do this process in my area, but no one does it without transfusions.
He's right. Most of the time, stem cell transplants also require whole blood transfusions. And as a Jehovah's Witness, that is against Davis's religion. So he found Dr. Patricia Ford at Pennsylvania Hospital's Center for Bloodless Medicine.
All right, this is the last one.
Dr. Ford performs so-called bloodless bone marrow transplants. To do this, she says, first the patient's own blood count has to be built up.
So there's a lot of different strategies by using iron and folate and some injectables that we use to stimulate the bone marrow to make some blood cells.
And she says blood is conserved, meaning fewer blood draws. After the procedure, patients are monitored closely and given medication to prevent bleeding.
Are you sure that's far enough?
Okay. The process of blood management is used for other surgeries as well. Jenny Galina has been getting those blood boosters for several weeks to prepare for a double knee replacement. She too is a Jehovah's Witness. But the techniques aren't just for people with religious objections to transfusions. Many are now standard throughout Pennsylvania Hospital. For joint replacements, Dr. David Nazarian may have patients donate their own blood a half an hour beforehand. It will go back to them after surgery. He likes it because there's less risk of transfusion-related infections, and the blood is fresher than when donated weeks ahead of time. During surgery, he also uses smaller incisions to limit blood loss and a cell saver machine to collect blood, filter it, and give it back to the patient.
They're getting their own blood back, which of course is much better for the patients, and more patients desire that technique.
As for Jock Davis, his prognosis is good. He's going home and says he is thankful Dr. Ford and her team were able to help him.
They accepted what my beliefs are, and they worked with that.
There are more than 120 bloodless surgery centers across the country. The biggest risk is the risk of losing too much blood. This is something patients have to discuss with their doctor. Allie Gorman, Channel 6, Action News.